Do you have sensitive teeth? Let's explore some of the causes, symptoms, and home remedies. Sensitive teeth, or dentin hypersensitivity, can be a source of discomfort and pain for many people. Whether it's a sharp, sudden pain after a drink of icy lemonade or indulging in a delicious bite of gelato ice cream, sensitive teeth can definitely be a buzzkill and stop you in your tracks. While professional dental treatment is often necessary for severe cases, there are several home remedies and lifestyle changes that may help alleviate symptoms and provide relief. Causes of tooth sensitivity. This dental pain occurs when the protective layer of enamel on the teeth wears down, exposing the underlying dentin and nerve endings. Several factors can contribute to this erosion of enamel, including the following. Brushing too hard. Aggressive brushing can gradually wear down enamel and lead to tooth sensitivity. Acidic foods and beverages. Consuming acidic foods and drinks can erode enamel over time. Gum recession. Receding gums expose the sensitive roots of the teeth, making them more susceptible to pain. Grinding teeth. Habitual teeth grinding can wear down enamel and increase sensitivity. Dental procedures. Certain dental treatments such as teeth whitening or dental restorations can cause temporary sensitivity. Symptoms of tooth sensitivity. The primary symptom of tooth sensitivity is discomfort or pain when the teeth are exposed to certain stimuli, including hot or cold foods and beverages. Sensitive teeth may react to extreme temperatures with a sharp, sudden pain. Sweet or sour foods. Sugary or acidic foods can trigger sensitivity in some individuals. Brushing or flossing. Aggressive brushing or flossing may exacerbate sensitivity. While professional dental care is essential for addressing underlying issues, several home remedies and lifestyle changes may help manage tooth sensitivity. Here are a few home remedies to calm and fix sensitive teeth. Use a desensitizing toothpaste. Desensitizing toothpaste, containing ingredients such as potassium nitrate or fluoride, can help block pain signals from reaching the nerves in the teeth. Practice proper oral hygiene. Brushing gently with a soft bristled toothbrush and using fluoride mouthwash can help maintain oral health and prevent further enamel erosion. Avoid acidic foods and beverages. Limiting consumption of acidic foods and drinks, such as citrus fruits and soda, can help protect enamel. Use a fluoride gel or rinse. Fluoride treatments prescribed by a dentist can help strengthen enamel and reduce sensitivity. Apply a saltwater rinse. Rinsing with a saltwater solution may help reduce inflammation and sensitivity in the gums. Chew sugar-free gum. Chewing sugar-free gum after meals can stimulate saliva production, which helps neutralize acids and remineralize enamel. Consider chewing gum with xylitol, which is actually beneficial for your teeth. Research indicates that the dental advantages of xylitol include a significant reduction of up to 90% in acid-producing bacteria. Additionally, xylitol prevents bacteria from attaching to teeth, thereby reducing plaque formation. Unlike sugar, xylitol doesn't metabolize into acids, thereby raising saliva pH levels and preventing acid formation. Try oil pulling. Oil pulling, the practice of swishing coconut or sesame oil in the mouth, may help reduce bacteria and promote oral health. Avoid teeth grinding. Using a mouthguard at night can help protect teeth from the effects of grinding. Get one from your dentist or online. When to see a dentist. While home remedies can provide temporary relief, it's essential to see a dentist if tooth sensitivity persists or worsens. A dentist can identify underlying issues, such as tooth decay or gum disease, and recommend appropriate treatment. In some cases, professional treatments such as dental bonding, fluoride varnish, or a gum graft may be necessary to address the root cause of sensitivity. In conclusion, tooth sensitivity is a common problem that can significantly impact daily life. While several factors contribute to sensitive teeth, including enamel erosion, gum recession, and dental procedures, there are several home remedies and lifestyle changes that may help alleviate symptoms. If you found this video helpful, please share, like, comment, and subscribe to Remedy Seeker for more health tips, and we'll see you in the next video.